Okay. So again, showing here is the anatomy of your ear. It is divided into three, external, you have the middle part and the inner parts. External, you have the auricle or the pinna. It is made of elastic cartilage. Okay, when you bend it, it will return to its normal shape. Then you have the ear canal going to the middle part. Okay, but before reaching the bone, you have the tympanic membrane or the eardrum. Okay, the bone consists of your malleus, incus, and stapes. Okay, then the stapes the one that naka-focus siya doon sa yung oval window. Okay, para pag nag-vibrate siya, then the vibration will stimulate your inner ear. Semicircular canal, which consists your cochlear and vestibular. Okay. Then you have your auditory here, auditory tube. For the assessment, so you need to get the demographic data, including the history of previous problem in the ear, or is there any problem with hearing. No? So it's not like with other system. Assessment in ear is focused on the middle and the inner ear, because in the external, obviously, you can easily inspect the characteristics or problem in the external ear. The evaluation of gross hearing acuity also include every physical exam. That's why mas hindi siya masyadong complicated if you're going to compare it to other systems. With regards to chip complaint, aside from hearing loss, then ear pain. No? Sa bata, sa mga children, mas common ang ear pain. You know that because of anatomical structure, the eustachian tube is still parallel. And once they get upper respiratory tract infections, those microorganisms can easily go to the ear. So then they will complain some problem, like, for example, inflammation in the middle ear, so on. So aside from ear pain or otalgia or your hearing loss, some but not common, like for example is obstruction, like for example foreign object or foreign body. But nonetheless, ear pain is the most common complaint. Okay, in assessing the external ear, so inspection of the external ear is common or very simple procedure. Okay, sometimes due to its commonality, na-overlook siya ng mga examiner. Okay, even the shape of the ear, the symmetry of the ear, minsan na-overlook nila, hindi nila na papansin kagad. Okay. So it is being examined by inspection and palpation, of course. Okay. They need to palpate the auricle and the surrounding tissue. Look for deformity. Baka yung shape ng ear is significant, right? Merong malalaki yung tenga, malalapad, maliliit, o minsan naman ay hindi siya symmetrical. Okay? Take note if there is lesions, baka may mga sugat or bukol, or even the discharges, no, coming from the ear canal. Okay? Yung cerumen, it is a normal discharge, but hard and impacted cerumen can cause obstruction and middle ear problem, like for example, conductive hearing loss. No? So manipulation of the auricle is not normally elicit pain. Okay, but when you manipulate the ear, let us say when you palpate the ear and the patient complain of pain, so there is a corresponding problem, because it is not normal to have a pain and it's just simple palpations. So you might suspect that there is some middle ear problem like otitis media. Okay. So tenderness on palpation in the area of mastoid. Mastoid is in the area behind the ear, no? So yun yung napapalpate nyo doong medyo matigas na structure because it is a bone, no? Your mastoid bone. If there is a tenderness, then you might as well think, baka namamaga yung mastoid. We call that mastoiditis. Okay? Sebaceous cyst and tophi, or your subcutaneous mineral deposits, they are present on the pinna. Okay? So, yung pinna, that is the most common area kung saan kayo lalagay ng studs, no? O yung mga earrings. So, mapapansin nyo, pag pinalpate nyo yan, minsan may bukol o may maliit na parang, ano bang tawag natin doon? Yung may bukol na may secretion na lumalabas, no? Tawag nyo minsan tophi, no? Common yan sa may mga uric acid, right? Tophi. If flake is scaleness behind the auricle, usually indicates seborrheic dermatitis. So kung natutuklap o natatanggal yung mga balat-balat, nagiging parang makapal na kaliskis. We call that seborrheic dermatitis, okay, which is also present in the scalp or even in the face. Next is otoscopic exam. So for otoscopic examinations, the tympanic membrane is inspected, of course, using your otoscope. Lahat naman nakakita na ng otoscope. No? It is a handy examination gadget. Usually, nakalagay lang yan sa coat ng doktor. No? So, what they are going to look at using that otoscope. So they will look on the ear canal. Of course, it should be positioned obliquely at the base of the canal to visualize clearly the eardrum or the tympanic membrane. Usually, it held in dominant hand, not specifically right hand. Kung ang doktor mo ay dominant niya ay kaliwa, then mas ease sa kanya kung left hand. Then the non-dominant hand will support the head of the patient. The normal color of your eardrum or tympanic membrane is pearly gray. Okay, pearly gray, and it is positioned obliquely. The following landmark are identified if visible. Okay, the pars tensa, the umbo, the manubrium of the malleus, and its short process. It should be inspected. So take note the position, the color of the membrane, any unusual marking or deviation from normal are documented. Presence of fluid, air bubbles, blood, or any lesion or masses in the middle ear should be also documented or noted. So if the tympanic membrane cannot be visualized because of cerumen or impacted cerumen, they might irrigate first the ear, no? Tawag natin ear irrigation. So yun yung gagawin nating skills sa inyong skills lab. May ipopost ako mamayang video about how to do ear irrigations, eye irrigations, even administration of drugs. So the use of instruments such as a cerumen curette, parang malaki-laki lang na konti dun sa panghintutulin yung ginagamit. No? So they use that to remove, but usually they need to soften first the cerumen. So magpa-flush sila dyan ng hydrogen peroxide mixed with normal saline para lumambot muna yung impacted cerumen. Then they can easily remove that via your curette. So your otolaryngologists and nurses who has specialized training in removing that, okay? Because if you are not trained to do that, you might puncture the eardrum, tympanic membrane. It is very sensitive, right? When you are when you're cleaning your ear, pagka naglilinis ka using your cotton buds, pag medyo napalalim ng konti yung iyong pasok ng cotton buds, nasasaktan ka kagad. Yes. Because it has many nerve endings there. Okay. So cerumen build up common cause hearing loss. Ang tawag natin ay conductive hearing loss. So tatandaan. Kapag hindi siya makarinig at ang cause ay pagbabara, like foreign object, foreign body, including impacted cerumen, what type of hearing loss? Conductive hearing loss. So type of hearing loss, I know you know this already. We define hearing loss as diminished hearing due to exposure to loud noises on daily basis. No? So it's not just because of only loud noises. Pwede ding trauma, no? Kaya ka rin nabibingi because of trauma. Or pwede ring inner ear problem. So sa hearing loss type, you have your conductive hearing loss. Example nga natin is cause of impacted cerumen. But your otitis media, especially the chronic and or your otosclerosis, formation of extra bone in the middle ear, can also lead to conductive hearing loss. The other type is sensory neural hearing loss. This time, the affected part is the inner ear. So the most common cause is damage in the cochlea, vestibular nerve. Okay. So if the patient both having conductive and sensory neural, then we call that mixed hearing loss. Okay. So para ulit madaling ma-analyze, you just remember those structure in the middle part and the inner. Okay? So lahat ng structure na from external hanggang dito sa gitna. Okay? Lahat ng problem sa part na to, conductive hearing loss yan. Then from oval window going to the inner part, lahat yan ay sensory neural na. Okay? So, halimbawa, yung labyrinth. Okay? You have two types of labyrinth. Membranous and bony labyrinth. So, kung namamaga yun, tawag nyo labyrinthitis at hindi ka makarinig, then ang type na yun ay sensory neural. Okay. Risk factors. You ask whether you have some family history, like for example, the inner problem, the Meniere's disease. So it can be acquired through hereditary, sa lahi. Congenital malformations, okay. More on middle and external part. Merong malalaki yung tenga, o meron namang atelia o absence yung ear, no? Halos magsarado yung ear. You identify those risk factors that can lead to hearing loss. Even recurrent otitis media can lead to hearing loss. Okay. If you are exposed to loud noises, not only those loud noises, mga anak, of course, trauma, but specifically now that we are always having flagging in this, what we call this, itong ating ginagamit na earbuds, no? Lagi tayong may nakasalpak sa tenga, and sometimes we cannot control the volume, no? So all the while, akala lang natin ay okay pa yung volume, pero palakas na ng palakas yung ating regulations. Pero ang iniisip natin, the same pa rin. Kaya lang, the more na na-expose tayo sa noises, nag-a-adjust ang ating tenga, ang ating hearing. So kung dati malakas na sa atin yung halimbawa ang regulation mo nasa 5, okay na, naririnig mo na ng maayos, pero dadating yung time nasa 7 ka na pero nahihinaan ka pa rin. So lalaksan mo na yun kasi ang ating perception ng hearing nagko-compensate din eh. Pag hindi mo na masyadong marinig, then you try to increase the volume, no? So later on, you will learn why it is happening, no? So nursing management, always face the client, okay? Lalo na kung ang client mo nga eh, hindi nakakarinig, okay? You know that communication can also be done by even non-verbal way, right? Maraming paraan. So by just facing the client, sometimes client can read your lips, what you are telling. When you talk to the hearing problem client, then you look in front. Huwag ka sa likod i-make. Mas maganda kung kaharap mo siya. Okay? Look and listen. Dapat di ka nagmamadali. Okay? Let the patient finish what she's telling or is telling. Should know the topic, okay? And speak slowly. In many cases, it's not just enough to just tell it to the client. You need also to write it. Kasi minsan, nahihiya lang yung client na ipaulit yung sinabi, but hindi pa rin talaga niya yung gets, hindi niya nakuha. So better to write it also. Okay? So evaluation of gross auditory acuity, we are using your tuning fork as your tool, right? It evaluate the auditory acuity. Ang katapat nito sa vision is your Snellen chart. Okay? But in hearing, it's your tuning fork. You have your Rene test. So para madaling tandaan daw, pag narinig yung Rene, katunog nung Dine, no? Dine. Rene, Dine. Dine sa likod ng tenga yan. Okay? Dine sa likod ng tenga. So saan nilalagay yung tuning fork? Behind your ear, no? Doon sa may bony part, sa yung mastoid po. So Rene test, compare air conduction from bone conductions. So it differentiates conductive and sensory neural hearing loss. So the vibrating tuning fork is placed against the mastoid bone. Okay, then it is placed 2 inches from the opening of the ear canal for your air conductions. So pag hindi na marinig doon sa bony part, saka nyo ililipat doon sa in front of your ear for air conductions. So for the interpretations, the normal air conduction is better than bone conduction, meaning the tone is louder in front of the ear. Conductive hearing loss, bone conduction is better or longer than air conduction, or the tone is louder behind the ear. For the sensory neural hearing loss, air conduction is better and longer than bone conductions. Okay, Rene test. How about the Weber test? So your rounded tip handle ng iyong tuning fork is placed in the client's forehead. Okay? Or pwede din doon sa front tip. Okay? Pero wag na sa front tip. Mas applicable kung sa forehead na lang. Okay? For the interpretation of the result, the normal is the tone heard at the center. So equal yung sounds on both ears. Okay? Conductive hearing loss, tone heard in poorer ear. Example, in cases of extra bone. Otosclerosis is formation of bone. particularly doon sa malapit sa stapes, no? Sa footplate ng stapes. Kaya hindi siya maka-vibrate. Kaya nawawalan siya ng hearing. Sensory neural hearing loss, the tone heard in better ear. Okay? And uses bone conduction to test the lateralization sounds. So the test is useful in cases of unilateral hearing loss. So bago ka naman mag-Weber, na-assess mo na yung patient. No? You already determine where is the problem. Is it on the left or right ear? Whisper test or whisper voice test. The examiner cover one ear with the palm of the hand, and then you whisper softly from distance of at least 1 to 2 feet from unoccluded ear. And of course, the patient should not see you. Person with normal hearing acuity can correctly repeat what was whispered. I'm going to discuss here the diagnostic test because we don't have enough time for the skills lab. First is the audiometry. Audiometry is the single most important diagnostic instrument in detecting hearing loss. So you have types of audiometry. Of course, the tool or the machine, we call that audiometer. Okay? Again, audiometer. So audiometry is the single most important diagnostic instrument, and the types include the pure tone audiometry. In pure tone audiometry, the louder the tone before the client perceives it, the greater the hearing loss. Okay? Again, the louder the tone before the client perceives it, the greater the hearing loss. Baka ang volume mo nasa sagad na, saka pa lang niya narinig yung sound. Okay? And we use pure tone audiometry. Speech audiometry. So spoken word is used to determine the ability to hear, discriminate sounds and words. So the louder the sound or the speech before the client perceives it, the greater the hearing loss. Okay? So they are using pure tone. Next is your tympanogram or impedance audiometry. It measures middle ear muscle reflex to sounds, stimulations, and compliance to the tympanic membrane. How? By changing the air pressure in a sealed air canal. So they test here the compliance, the compliance of your middle ear. Usually, they can detect whether there is a middle ear impairedness with regards to conduction or vibration of sounds. 3 important characteristics of hearing evaluations, one of which is the frequency. Frequency refers to the number of sound wave emanating from the source per second. Ang ginagamit nating unit dyan, mga anak, ay hertz. Okay? So the normal human ear can perceive sound ranging from 20 to 20,000 hertz. Other one is the pitch, So the pitch is used to describe frequency. Okay, a tone with 100 hertz is considered low pitch, and a tone with 10,000 hertz is considered high pitch. And the third one is the intensity. Intensity, it measures the loudness. Okay, and the unit we are using is the decibel. Decibel is the pressure exerted by the sounds. Next, your oculovestibular test or caloric eye waters test. caloric ice water test. So they're usually using this by irrigating the air with cold water. No? So kapag nag-irrigate sila, they can test whether there is problem in balance. Okay? Balance, and sometimes the eye will also react with regards to ice water test. No? So kapag nag-irrigate, then they will also subject to use tympanogram. Okay, so makikita nila dyan kung stiff yung ear, okay, or hyperplacid yung kanyang ear response. Another test is your electronystagmography. You'll notice the significant word here is the nystagmus, no? Nystagmus is involuntary eye movement. Okay. For electronystagmography, it is the measurement and graphic recording of changes in electrical sounds. Okay. This electrical potential created by eye movement during spontaneous, positional, or calorically evoked nystagmus. So kung doon sa ice water, yun kasi yung medyo old type of test. Mas recent ito kumpara doon sa ice caloric. So they both test the positional, the balance, the eye movement, okay. So it assesses the oculomotor, the movement of the eye, the vestibular system, and their corresponding interactions. So it is very significant in diagnosing conditions like Meniere's or the inner ear problem, even the tumor of the internal auditory canal located in the posterior fossa. So for the nursing intervention while doing this procedure, so you need to hold the vestibular suppressant. Okay? So kung may iniinom siyang gamot, like for example, tranquilizer, okay, Valium, haloperidol, ganun, okay, or even alcohol, because it can suppress, no? It can suppress the vestibular functions. So you need to hold it for 24 hours prior to the test. Explain the procedure to the client. Obviously, this is for you to gain cooperation so that the patient is aware what going to do. For the platform posturography, it is recommended for patients with dizziness and balance problem. Okay, so can be used to determine patients' vertigo is worsening or to evaluate patient response to treatment. Okay, in short, ano lang ba yung problem sa ear na may vertigo? That is your Meniere's, right? Meniere's disease. So, kung nagre-respond siya sa management o nare-relieve siya from vertigo, because vertigo can take the attack of vertigo, it can take many days, even a week, no? So pag nagbe-vertigo, minsan sa buong linggong naka-bed rest. So the patient stand on platform surrounded by screen, different conditions like moving platform with a moving screen or stationary platform with moving screen are presented. Depende kung alin ang paiikutin. Okay? So the response from the patients on 6 different conditions are measured and indicate which of the anatomic system may be impaired. Next is sinusoidal harmonic accelerations. It is a rotary chair which is used to assess the vestibulo-ocular system, okay, by analyzing compensatory eye movement in response to the clockwise rotation of the chair. So paupuin ka dun sa movable chair, yung naiikot, then they will observe for the eye movement. No? So although such testing cannot identify the site of the lesion in unilateral disease, it helped to identify disease like Meniere's and tumor in the auditory canal. To also evaluate the course of recovery. No? Next, middle ear endoscopy or visualization of the middle ear. So it evaluates suspected perilymphatic fistula or the new onset conductive hearing loss and tympanic cavity. Okay, so it can easily view or examine the middle ear. Okay. Middle ear endoscopy is performed safely and effectively as an like office procedure or outpatient to evaluate suspected fistula. So the tympanic membrane is anesthetized topically about 10 minutes before the procedure. Then the external auditory canal will be irrigated with normal saline. With the aid of microscope, a tympanotomy is created, bubutasan yung eardrum, with a laser beam or a meringotomy knife so that the endoscope can be inserted going to the middle ear cavity. You can take photo or video for the documentations, no? So that they can review it again. So that it's for the assessment, no? Assessment, including the diagnostic test. If you have no questions, you have questions in the diagnostic test, we will proceed on the different disorder in the ear. Pala mga anak, ha? May I remind you that your midterm exam, we will be processing it doon sa period na synchronous. Kuha lang tayo ng konting oras asynchronous. Okay? Para ma-process natin yung midterm exam. Then, matataas ang grade nyo sa skills lab at saka sa clinical. Okay? Sa lecture, okay lang. Pero hindi ganoon katataas, no? Expected naman natin 'yun dahil medyo mahirap talaga ang lecture compared to skills in clinical. The thing is you need to participate much more during recitations and Kahoot, no? Kasi kasama siya sa computation ng inyong activities. Remember that the grade is computed coming from different area activities, which consist of your online participations, even recitations, no? Quizzes. Okay? Mas mataas pa ang percentage ng activity kaysa quizzes. Okay. So, kailangan improve nyo yung part ng recitations and participations. So kung hindi ko kayo naririnig and pag tinatawag kayo ay wala, then mababa yung inyong recitation grade. Okay. Let's proceed to congenital problem in the ear. So congenital problem in the ear, such as your atelia, I mentioned this a while ago. Atelia means absence or closure of the auditory canal. I think may nakita na kayong ganyan mga picture sa inyong health assessment, no? Minsan maliit, minsan parang naka-twist yung ear covering the canal, no? Or an abnormal size or protrusion of the auricle. Baka naman yung ear mo ay para ka ng yung mahaba o matulis yung parang mga dwarfs. So you need to take note with that. So sabi nung iba, pag malaki yung ear, mahaba ang buhay. o matalino, no? Pag maliit, eh, maiksi lang ang buhay, something like that. That is only myth or kasabihan. Otoplasty, so kung naka-twist o nababarahan niya yung kanal, kasi yung structure niya is not properly aligned, they can do repair. Okay? We call that otoplasty. It is the correction of the external ear deformity. Example is the protruding ear. For the impacted cerumen, it says that the impacted cerumen is blocking the external canal. Okay? Tigas talaga yan. Lalo na kapag minsan they will detect it accidentally, lalo sa mga bata. Bakit bumababa yung grade nila? Bakit yung kanilang performance ay bumababa? The thing is, hindi na pala nakakarinig yung bata, no? So, hindi na niya naiintindihan yung sinasabi ng teacher. So, when they evaluate and they will do physical exam, pag in-examine yung ear, nasasaktan yung bata, then they will look for any obstruction. And they will find out that impacted cerumen is the cause, no? So, otalgia means ear pain. Sakit yung tenga. No? Hearing loss, what type? We call that conductive hearing loss. So, for the management, I mentioned about irrigations, pwedeng suctioning, pero kung talagang matigas na matigas ayon, hindi madadala sa suction. Okay? So, what they will do, they will irrigate, then they will suction. Okay? Or kung talagang nabivisualize na at hindi madala ng hydrogen peroxide, then they can use curette, no? Yung instrumentations. Kukutsarahin na. Okay. Isang factor dyan, pag naglilinis kayo ng tenga, ginagamit yung earbuds, yung malalaki. No? So, instead na makuha, pinupush nyo siya paloob. Piliin nyo yung masyadong malaking earbuds. Okay, another problem is your tympanic membrane perforations or na-trauma or nabutas yung eardrum. Okay? Can be caused by presence of otitis media or infections or trauma. Okay? Tympanic membrane can rupture if the pressure in the middle ear exceed the atmospheric pressure in the external auditory canal, which is true. Kaya yung iba, halimbawa, yung mga diver, you know, when you are in deep water, naka-immerse ka sa tubig, you've noticed na parang tumataas yung pressure sa iyong ulo, okay? Even sa iyong tenga. So pagka nagtagal ka pa doon, or even in the airplane, no, pwedeng pumutok yung tympanic membrane. Pwedeng magdugo yung iyong tenga. So management, i-repair yung tympanic membrane. Okay? We call that tympanoplasty. Okay? For the otitis externa, externa means labas or external. Okay? So yung pamamaga ay nasa external auditory canal. Call that otitis externa. Ganyan. So commonly, kapag ito ay otitis externa, the cause is trauma. Okay? Infection, chemical, or even endocrine problem like diabetes mellitus. Okay? Vitamin deficiency. Pero ang common dyan, trauma o kaya may nakakagat na insect. Yan. Pwede ding dermatosis. So clinical manifestations, there is pain. Of course, there are discharges coming from auditory canal. Oral tendency, sabihin, tendency na hindi siya makarinig. Fever, cellulitis, ito yung cellulitis. Yan. Pulang-pula, tapos namamaga siya. Pwede ding magkaroon ng kulani, okay? Lymphadenopathy sa cervical area. Okay. So pruritus, hearing loss, and feeling of coolness. So what to do in order to determine what is the problem? You need to do otoscope examinations. No? Look for the ear canal. Kaya lang, masakit siya, right? At susuotan mo siya ng speculum. So you need to take extra care. Okay? So ear canal is erythematous and edematous. Namumula na namamaga. Discharge may be yellow or green, following by foul smell. Okay? So kung yellowish na, sabihin meron na yung pus. Nagnanana na yan. If fungal infections, then there will be visible hair-like black spores when they look under otoscopic exam. Okay. Management, then you follow the principle of therapy, and the main concern is first relieving from pain and discomfort. Then you give the patient analgesic. But we know that even giving analgesic, for example, if the infection is there, the pus or yung nana, hindi natatanggal, then there will be still pain, right? So, reducing swelling of ear canal, you give anti-infla, corticosteroids. Then, I mentioned about the infection. So, to eradicate infections, you give antibiotic if it is bacterial. But if it is fungal, then you give antifungal. Okay? Antibiotic, ang tawag natin ay otic drugs or otic preparations. Remember, pag mata, ang tawag natin ay optic. Right? So, tuturuan din kayo how to administer otic drug. Okay? Ano nga yung ating merong kasing yan merong procedure for adult and for children, right? Paano hawakan ang tenga when you are instilling ear drops or ear drug. Okay? Pag adult ba pataas? Adult, up. May U yata dun eh. So up, back, right? Pataas, tapos backward. Pagka children, parang down yata pagka children. Am I correct? Nakuha nyo na to eh sa inyong health assessment. Tama ba? Guys?
Yes po.
Okay, so pag adult, may U, no? Up yun. Up, backward. Pag children, pababa, down. Okay? Down, tapos backward. So management, wick is inserted in anal canal that liquid medication can be introduced. Yung wick para siyang speculum. No? So administered medication by dropper or at room temperature. Instruct client not to clean the external auditory canal with cotton tip applicator to avoid trauma to the canal. Ang ibang ginagawa dyan ng doktor, pagkatapos nilang mag-instill ng gamot, then they will put cotton balls, no? Ilalagay doon sa harap lang naman, not totally doon sa kanal. No? just to protect the medications. Then they will not let the patient to stand up immediately. So they will tell the patient to wait for quite some time, 5 to 10 minutes. So yung air barrier to water contaminations, that is what I'm telling, a piece of cotton ball. Okay. Sometimes they will put petroleum jelly, lalo na kung liligo, no? Para hindi mapasok ng tubig. Okay, so that is for the externa. Next is the otitis media, refers to middle ear inflammations. Okay, you have types of otitis media. You have the serous type or the secretory otitis media. Presence of fluid without evidence of infections. Okay, so this type of otitis media, namamaga din yung kanyang tympanic membrane, but the cause is not a bacteria or microbes or fungal, no? You know, otitis media, ang common dyan yung bacterial, no? Yung upper respiratory tract infections, lalo sa bata. But for the serous type, there is no infections. Ang common dito sa mga swimmer, right? Saka doon sa mga air traveler. So pag natatrap yung tubig at yung air at tumaas yung pressure, na-absorb yan ng membrane, kaya yung tympanic membrane, which will cause inflammations. So the blockage in the eustachian tube causing the air to be trapped in the middle ear, producing thin fluid as the surrounding tissue absorb the air. Okay. So when you look at the tympanic membrane, may mga content siya ng secretions, no? Di ba, you know naman what is effusion means. Effusion, marami siyang na-absorb na fluid more than the normal amount. Okay? So it involved fluid without evidence of active infections. So if you inspect the fluid, hindi siya yellowish, hindi greenish. No? Ibig sabihin, clear lang yung fluid. Mostly, ang tawag dyan ay, ano ba yan? Barotrauma. Okay? Kasi baka ito yung makita nyo sa exam. When you say barotrauma, it is a trauma caused by increasing pressure, either caused by water or air. No? So yung mga diver, ang common magkaroon ng otitis media. What type? Secretory. Causes. So pwede ding congenital problem, immature yung musculature formation ng kanyang middle ear, or chronic upper infections. Okay. Oh, this is one, the barotrauma. So for the pathophysiology, we know that the eustachian tube is connected on your middle ear. Okay. Once it is obstructed, then the negative pressure in the middle ear will increase. And the fluid in the middle ear will be absorbed by the membrane, forming exudate. Okay. When there's an increased pressure enough to bulge and rupture the membrane, then marirelease yung secretion, tutulo yun sa tainga pag na-rupture na. Okay, so this illustrate the processes. So what is the normal color of your tympanic membrane? Pearly gray, no? Pearly gray. So, erythema only, no effusions. Erythema with air, fluid level, but clear fluid. Ito mapulang-mapula na. At mabintog na siya, meaning may tubig yan sa loob, may effusions. No? So, kita nyo dito, meron ng parang paltos. Okay? Yung white surrounding membrane. So, anytime, pwede na yung puputok. So, erythema with opacifications, air fluid level, air bubbles, but no bulging. Here, erythema, complete effusions, no bulging. Dito, nagbabulge na siya. And this one, pwede na siyang mag-perforate. Another illustrations, no, showing the otitis media formation in the middle ear. Ayan. So behind your middle ear is your mastoid bone. Okay, so you can easily analyze when you have a chronic otitis media. Chronic otitis media, ibig sabihin, kinakain na yan ng infection, no? Pag kinain niya ng mga nana, aabot na niya yung buto. Then you can have mastoiditis also. So signs and symptoms, feeling of fullness in the ear, fluid also coming out from the tympanic membrane. Then you will have unnoticed hearing loss. Again, what type? Conductive hearing loss. Yeah. Otalgia or ear pain. Then you have your ear discharges. Okay? So you need to characterize the ear discharges. Anong kulay? O is it odorous? And you will hear, patient will hear popping or crackling sound. This is because of presence of effusions or water. You know? The tympanic membrane appear dull on otoscopy. Air bubbles also is present in the middle ear. Medical management, then they will put opening, no? Laryngotomy. They will put a hole or opening in the tympanic membrane. Then they will put grume. Ang grume para siyang drain. Okay? Kaya lang sa hospital, nakikita yung drain, yung ginupit na, yung ginupit na gloves. No. Grume is different. Para siyang tube. It is inserted to serve as the channel. Para siyang magiging, ano bang tawag dyan? Tubo. And it also keep the tympanic membrane unblocked para makarinig siya. Okay, you give anti-inflammatory also to decrease edema, okay, which is caused by your barotrauma. And para maiwasan tong barotrauma, lalo kung ikaw ay mahilig mag-air travel, no? You need to, sometimes ang iba nag-chewing gum habang nag-air travel. Kasi pag lumulunok ka, nare-release yung pressure, no? Kasi magka-connect nga yung sa tenga, sa bibig, saka sa ilong para ma-release mo yung pressure sa middle ear. nung umuwi kami, yung aking eldest, ano pa lang siya noon, 8 months old. So, 9 hours travel kami. Naka-pacifier yung aking anak. Kasi nga hindi pa siya hindi pa ganoon ka-mature yung kanyang eardrum. So very delicate pa. So to release the pressure, something that you will always swallow para ma-release yung pressure sa loob. Ito yung grommet tube. Ayan. So another procedure with the use of syringe, no? Kaya lang you will be needing a special type of syringe to suction the secretion inside the middle ear. And ito medyo kailangan ay talagang well trained para hindi mo over punctured ang yung tympanic membrane. Next, acute otitis media. This is an acute inflammation of the middle ear commonly seen in children. Okay, usually lasting less than 6 weeks. Okay, medyo matagal-tagal yung suffering ng bata. Causes, I mentioned about upper respiratory tract. Okay, for example, Streptococcus pneumoniae or Haemophilus influenzae, even Moraxella catarrhalis. Okay. Another causes is allergy, of course, rhinitis, and presence of serous type of otitis media. So yung barotrauma na nag-cause ng serous type, it can lead to acute otitis media. Pwedeng magkaroon na siya ng accumulation ng bacteria or microbes. For the pathophysiology, again, the cause mainly is upper respiratory tract, okay, or allergic reactions. So what will happen? It can cause obstruction sa yung middle ear. When that happens, pressure will increase, okay? When the pressure increase, it will undergo doon sa mga picture nating, doon sa stages, no? Which will lead to obstruction, perforation of your eardrum. Okay. When it perforates, it will contaminate the nasopharynx. Okay. Middle secretion enter your endotracheal tube or your eustachian tube, not endotracheal, eustachian tube. Okay. Then purulent exudate in the middle ear are present, and patient might complain loss of hearing. Okay. Kasi pag nabutas na yung middle ear, remember, yung sound kasi magba-vibrate doon eh. So, magkakaroon ng impairment pag-vibrate na going to the next stage or malleus inclusion stage. Okay, signs and symptoms. You will see some discharges coming out from the ear canal, and it is more on yellowish in color. Medyo maamoy, ha? Kasi may pus, no? Nostalgia or ear pain. Patient is having fever. Yeah. Remember that the serous type, wala naman siyang fever. But it can lead to acute type. So you can see tympanic membrane bulging and redness through your otoscope. Okay. So ito yung normal, pearly gray. Then ito naman yung erythematous na tympanic membrane. For the management, you need to culture and sensitivity to sa discharges in order to distinguish what type of microbes so that you can give correct antibiotics, right? But since sa atin, sa Pilipinas, it will take days bago pa ma-release yung culture and sensitivity result. Kaya ang ginagawa ng ibang mga doktor, they will start already antibiotics. Anong ibibigay na kaagad? Ibibigay na kaagad yung mga broad spectrum na antibiotic. Sabihin, pwede sa gram positive, pwede sa gram negative. Gano'n. Kasi medyo matagal bago ma-release yung culture and sensitivity. And they want to start antibiotic immediately. You can apply warm compress to relieve the pain somehow, or it can also dilute, no? It can liquefy the secretion kasi medyo sticky or yung yung lumalabas na secretions. So warm compress can give much comfort to the patient. For pain, of course, analgesic. Warm olive oil drops, it also gives soothe or it helps in reducing inflammation ng tympanic membrane. Surgical management, then you have your myringotomy or tympanotomy. Okay. Complications, I said a while ago that it can affect your mastoid bone, okay, because it's just behind your tympanic membrane. So it can affect your mastoid bone, can lead to mastoiditis. So acute mastoiditis is an abscess developed in the mastoid bone and can also burst out behind the ear. So makikita mo naman yon sa likod ng tenga, mapulang-mapula na yung iyong mastoid bone. But don't be mistaken because dun sa inyong neuro, remember the battle sign, okay? Yung battle sign, kapag meron siyang basilar fracture, mapula din yung likod ng tenga, pasa-pasa. Yeah. The raccoon eye and the battle sign. You can relay that if you already watched that video PowerPoint. The third type is the chronic otitis media, of course. Okay. So, it is caused by repeated attack of acute otitis media. So, kung lagi kang nagkakaroon ng acute type, then can proceed to chronic type, where there is permanent damage, okay, in the tympanic membrane, causing perforation and persistent discharge. So, signs and symptoms, there is oral pain, o yung auricle, tenderness, and exudate formations. Okay. So, meron ding ear pain and deafness. Again, conductive hearing loss. Yeah. The difference in acute, sa chronic, meron na siyang cholesteatoma. Okay? Sa acute, wala. So, what is cholesteatoma? Cholesteatoma is an ingrowth of the skin, the external layer of eardrum, into the middle ear. Okay? So, meron niyang parang cyst. Yung ingrowth, another term ay cyst. Okay? Ang cyst, meron siyang merong nakabalot na membrane, tapos nandito yung inyong mga infections, yung mga nana, ganyan. Na pwedeng lumaki yan. Kakainin niya ng kakainin yung mga surrounding tissue hanggang maabot din yung buto. So in chronic otitis media, it occurs when the eustachian tube becomes black repeatedly due to allergy, due to acute otitis media, okay, even due to trauma or swelling of the adenoids. Yeah. Management, give antibiotic. Okay, again, after culture and sensitivity, you can do irrigation to control the discharges. Okay, tympanoplasty, since butas na talaga siya, no? Lalo na kung pag tinanggal mo kasi yung utos, ito, ano? Pag tinanggal mo ito, cholesteatoma, mag-iiwan niya ng malaking butas. Okay, yung cyst. So, kailangan mong takpan yun. Kailangan mong i-repair. No? So, tympanoplasty means repositioning the ossicle, replacing it with a piece of bone. So, reestablish middle ear functioning. You need to close the hole, the perforated area, improving the hearing and preventing recurrent inflammations. For myringoplasty, It's also done to close the perforated area of tympanic membrane by using piece of fascia. Saan kukuha? Sa temporalis muscle. Okay? So yung temporalis muscle sa may temporal mo, kukuha sila doon and yun ang itatagpi or ilalagay doon sa area kung saan nabutas yung tympanic membrane. So for the nursing management, you need to decrease level of anxiety of patient. Lalo na kung mga nasa teenager na, dadalaga at binata na, no? Mas ano yan, mas iba yung level ng anxiety. Hindi sila makalabas, no? I remember I have one third year nursing students, nasa area kami. Then, napansin ng kaklase na mayroong tumutulo dun sa tenga niya. Siyempre, medyo awkward, right? So, provide comfort to decrease pain and prevention of injury and complications. So, pag tinanong what is the major complication of otitis media? Or mastoiditis, no? Una-una, mastoiditis. And of course, hearing loss. Okay, so this shows the process for how to do tympanoplasty. Ito yon, may butas, then nilalagyan nila ng graft. Okay? So, kung sa iyong sarili mo kinuha yung pang-graft, ang tawag ay alloderm, right? Or allograft. Allo means itself. In growth of the skin of the external ear to the middle ear, extending to the mastoid region. That is your cholesteatoma. So it is a benign, growing cyst tumor in the middle ear and mastoid area. So paano siya nag-form? Due to repeated otitis media or chronic otitis media. So signs and symptoms, there's also conductive hearing loss, offensive but not scanty discharge, pain due to perforation of the tympanic membrane. Mga anak, tinnitus is ringing ears, okay? Ringing of ears. Vertigo is severe dizziness. So ito yung cholesteatoma. Siya. So management, radical mastoidectomy. When you say radical, di buo, no? Patanggalin yung mastoid area. So radical mastoidectomy is done to remove the tumor and drain the mastoid air cells. Complications, since na-create ka ng opening and the mastoid area is very near already in the brain, no? So it can have a brain abscess, meningitis. Ito yung common na nakakasama sa exam. Okay? Since kung ito yung iyong tenga, okay, sa likod niyan, di ba, nandito yung iyong mastoid bone. Yung facial nerve kasi, dyan dumadaan, papunta sa facial part. So pag biniyak nila yan, minsan, natutrauma yung facial nerve, which can cause facial paralysis. Okay? Ito yung common. So pagka nag-undergo ng mastoidectomy, patient might have facial paralysis. Next, You have questions so far? No questions?
Wala naman po.
Next is foreign bodies. Okay. Again, this is most common sa mga bata. Very unusual na yung mga adult na magkaroon pa ng foreign bodies sa tenga. Okay? But it can also happen, lalo na kung natutulog, no? At napasukan ng mga insects. Pero sa adult, common na yung mga insects. Sa mga bata, common na yung mga seeds, no? Beads. Ayan. Kasi sabi nga natin, lalo yung mga nagko-crawl na mga baby, the way of learning of baby is through touch and taste. O kaya, pag hinawakan, ipapasok sa mga butas-butas. The thing is, if it is insect, okay, ang insect, let us say, ant, langgam, lumalakad dyan eh. And if you're going to look langgam or insect under microscope, yung paa nila may mga spike, no? May mga spike. Nakita mo mga matutulis na spikes, ganyan. And your tympanic membrane is very sensitive. So, pag lumakad yan sa loob, napakasakit. No? Kahit pagano kahimbing ang tulog mo, magigising ka. So, your goal is to stop the insect in walking. Or your goal is to kill the insect. Yan. Seeds. Ay, kung napasukan niya ng mga buto ng pakwan, buto ng munggo, okay? Then, pag naliligo ka, siyempre, hindi na iwasan, natutubigan yung tenga. So, pwede yung magdahon, pwedeng mag-grow yung seeds. So, yung munggo, pwedeng maging possible na, okay? Sa loob ng tenga. Another thing we mentioned is the impacted cerumen. Okay? Yung mga beads or pebbles. So management, irrigation, if it is impacted cerumen. Okay? We use oil, mineral oil, in killing the insect. Okay? So paano papatayin yung insect? Lagyan mo ng oil, mag-instill ka ng oil. Ang sabi ay lagyan daw ng asukal doon sa labas ng tenga para lalabas yung insect. Hindi lahat, no? Kasi lahat mas malimit pa, lalong dumadami yung insect. Doon naman sa seeds, so kung ang suspect mo ay seeds, then prevent not to wet the seeds para hindi siya matubigan, mabasa. Kasi pag nabasa yan, magdadahon talaga siya. Okay, you can do suctioning also and instrumentations. Meron tayong mga instruments. Sometimes ang tawag ay curette or yung alligator forceps. Yung alligator forceps, mahaba siyang forceps. Tapos yung dulo lang yung nag-o-open yung yan. So, nakokontrol mo siya using your otoscope also. You can use biomicroscopic probe para kita mo kung saan nakalocate yung object. Next is otosclerosis. Otosclerosis, it is an abnormal, spongy, highly vascular bone grow across the margin of the oval window. Okay? Mas malimit sa footplate ng stapes. Okay? So, pagka nagkaroon ng extra bone doon sa footplate, then hindi makaka-vibrate ang iyong stapes. Okay? Anong tawag? Otosclerosis. Otosclerosis, may extra bone. Yan. So, the growth of vascular bone in this stapes, and it become hardened, okay? Maninigas, parang magiging stiff yung iyong stapes. Mas common siya sa babae, huwag nyo nang itanong kung bakit. Kasi, unknown, bakit common siya sa babae. It can also acquired through hereditary. So again, your stapes is in the middle part, right? Middle ear. Kaya anong type ng hearing loss? Conductive hearing loss. Okay, so when there is a new or spongy bone located in the foot plates ng stapes, what will happen to the stapes? Magiging fixed siya, hindi siya makaka-vibrate, hindi makakagalaw. Okay? Then the stape cannot vibrate, and when it cannot vibrate, then hindi niya mapupush yung sound from malleus to incus, okay, to the middle ear. And you will have your conductive hearing loss. Next, management. So tatanggalin yung extra bone or the stape itself kasi nasa foot plate. So pag tinanggal mo yon, matatanggal pati yung stape. Tawag ay stapedectomy or bubutasan lang if it is just small bone, no? So stapedotomy. So the mobile part of the stapes is removed. Tapos gagawa sila ng butas, okay, to fix the foot plate. Then lalagyan nila ng extra bone or piston, okay, in the hole and hook around the incus to reestablish the vibrations of sounds. So another management is prevention of injury. Okay, it can cause dizziness and vertigo. Sodium fluoride to it somehow correct some problem in the dizziness. But this is not the same with your antihistamine drugs. No? Hearing aid, mga anak, alam nyo naman that the hearing aid will not cure the deafness. Ibig sabihin, hindi niya mapapagaling yung iyong pagkabingi. Okay? Pinalalakas niya lang yung sound. So if this is the stapes, diba? Ito yung extra bone. So ano siya doon, parang ano ba yung tawag natin pagka nilalagay natin sa gulong para hindi umatras. So meron siya nakaangkla doon na extra bone which will lead to the stapes not to vibrate. No? To the bony niche itself to the stapes, preventing normal transmission of sounds. Correct. Okay. So we're done on the middle part. We mentioned about the otitis media, the mastoiditis, the otosclerosis, right? Again, to differentiate again, the serous type of otitis media is non-infectious. Mostly common cause is barotrauma, diver, and air traveler. Okay. Acute otitis media, common in children, due to structural positioning of your eustachian tube. Kaya pagka may upper respiratory tract infections, then the microbes can go easily to the ear, middle ear, right? So management is laryngotomy. Then you have the chronic type. Chronic type is caused by repeated otitis media or pediatric trauma, right? The difference of the two, acute and chronic, meron siyang cholesteatoma. Cholesteatoma, it is a growth or cyst which can involve the mastoid. Okay? So magkakaroon siya ng opening and it can also damage the mastoid bone. So acute mastoiditis also. Management, tympanoplasty, laryngotomy or laryngoplasty, and mastoidectomy. Kapag may acute mastoiditis na, then radical mastoidectomy na ang ginagawa. Tatanggalin na yung buong buto. The problem is they might have complications. The most common is facial paralysis. No? Nai-hit yung facial nerve. Okay. Then another one, otosclerosis, formation of extra bone located in the foot plate of the stapes. Management, stapedectomy or stapedotomy, yeah, removal of the stapes. Pwede naman silang mag-anchor ulit doon ng panibagong buto. Commonly, saan sila kumukuha? Sa cadaver. No? Kuha sila ng cadaver bone at siyang ipapalit. Okay, next is the Meniere's. Another term of Meniere's is endolymphatic hydrops. So it is characterized by accumulations of endolymph in the inner ear. It is chronic with remission, ibig sabihin, bumabalik. Okay? Umaatake palagi. And it can progress or exacerbate. Ang katapat nito sa eye disorder is uroglaucoma. Okay? So ito na yung pinakamalalang sakit which can lead to deafness. Call that Meniere's disease. Okay, the cause is unknown, but can be due to stress, okay, allergy, virus, trauma, malabsorption of endolymphatic system, okay, and hemorrhage, of course. The abnormality in the inner ear where the fluid balance caused by malabsorption of endolymphatic sac. Pwede ding blockage ng endolymphatic sac. So for the pathophysiology, then let's start with the etiology or the cause. It says that the cause or the etiology is malabsorption of endolymphatic sac. And what is in the endolymphatic sac? Nandun yung fluid, right? The endolymphatic fluid, the endolymph. So blockage in the endolymphatic duct can lead to increased amount of endolymphatic fluid or endolymph. Then the membranous portion of the labyrinth, kung saan nandun yung endolymph, will dilate. Okay? And the dilation can lead to abnormal ear fluid balance. Okay? So, endolymphatic hydrops might occur when the balance become altered. Dito, ma-experience na ng patient dito yung vertigo. Okay? Vertigo. And of course, your tinnitus or ringing of ears. Head rotating is your vertigo. Okay? Or sometimes it is described as severe dizziness. So you have a triad symptoms in Meniere's disease. Okay? We called it episodic vertigo. You have the tinnitus or the ringing of ears or unwanted noises in the head or ear. And the third one is the fluctuating hearing loss, right? The fluctuating hearing loss, specifically sensorineural hearing loss. It may also include feeling of pressure or fullness in the ear, incapacitating vertigo, often accompanied by nausea and vomiting. Okay? So fluctuating pressure, tinnitus, and spells of vertigo lasting 2 hours followed by imbalance that may persist hanggang weeks, no? Tagal yun eh. So the symptoms range severity from minor to extreme disability, especially if the attack of vertigo are severe. At the onset of the disease, usually only 1 or 2 of the symptoms manifest, but as it progresses, then the patient might have sensorineural hearing loss.
Some characterize the disease into two subsets. You have the cochlear and vestibular. The cochlear Meniere's disease is recognized as the fluctuating progressive sensorineural hearing loss associated with tinnitus, okay? Absence of vestibular symptoms or findings. Hindi siya nahihilo. But in vestibular Meniere's disease, it is characterized by the occurrence of episodic vertigo associated with aural pressure but no cochlear symptoms. Hindi naman siya nabibingi. Okay? So patient may experience either cochlear or vestibular disease symptoms. Eventually, all symptoms develop as the disease progresses. For the assessment and diagnostic test, usually the most troublesome complaint related to Meniere's is vertigo, right? So, ang i-check muna ay yung balance. Check for the equilibrium and balance, we do Rumberg test. Okay. You need also to take the history carefully to determine the frequency, durations, right, the severity and character of vertigo attack. So, aside from vertigo, pwede niyang magkaroon ng diaphoresis, persistent feeling of imbalance or disequilibrium, which can awaken the patient while sleeping. Okay, they also report that the feeling lasted for days. However, they usually feel well between the attack kasi nga may remissions. Okay. Physical exam findings are usually normal with the exception of those cranial nerve number 8. So you do Weber test. Weber test may lateralize the ear opposite the hearing loss, the one affected with Meniere's. Okay. Another one, audiogram. The audiogram typically reveal a sensorineural hearing loss in the affected ear. Okay, you can do also Weber test, the tone which is lateralized in good ear. Ang audiogram, na-discuss naman natin kanina what is audiogram. Another one is your electronystagmogram. Ayan. It may be normal or it may show reduced vestibular response. For the management, bed rest during the attack, lalo na in severe attack. Okay? To reduce fluid, the indulymph fluid, you need to decrease sodium intake, low sodium diet, okay, to reduce or prevent retention of water. Avoid food with preservatives. We know that most preservative foods are high in sodium. So you need to avoid foods with preservatives. Avoid drinking large volume of fluid. Kasi meron na siyang high drops, right? May build up of fluid na doon sa ear. Avoid reading during vertigo. And actually, you cannot read when you have vertigo. You cannot even open your eyes in severe attack of vertigo. Avoid alcohol, caffeine, and tobacco. Okay, because it can trigger your vertigo. Because very important, stress therapy. The attack usually precipitated by the stress. Okay, you know, if you have Meniere's, wala hindi naman gumagaling pag may Meniere's. Progressive siya. Then, ang management ng Meniere's, naka-focus lang sa prevention ng atake ng vertigo. And we know that vertigo is stress-related. Kaya very important stress therapy. Bawal may stress ang may mga Meniere's. Okay. So for the medications, to decrease the effect of vertigo, then patulugin mo yung patient. Right? You give tranquilizer. Bigyan mo ng mga Ativan, Yung mga ginagamot nyo sa mental patient, di ba? Tranquilizer. So, pag tulog ang patient, di walang vertigo. Vagal blocker or your atropine sulfate can also reduce the secretions. Give antihistamine specifically to suppress the autoimmune effect. Okay. Vasodilator, diuretics, but this time we use thiazide diuretics. Okay, so thiazide, mas marami siyang ine-excrete na sodium. Okay. For nausea and vomiting, can give antiemetic. Okay. For surgery, endolymphatic sac decompressions, which equalize the pressure in the middle ear. So endolymphatic sac decompression or the shunting, right? Shunting, it equalizes the pressure in the endolymphatic space. This procedure is favored by many doctors at first-line surgical approach to treat the vertigo. It is simple and safe and can be performed in outpatient basis. Next, middle and inner ear perfusions. Ototoxic medication like streptomycin or gentamicin, they are antibiotic. Administered by infusion into the middle and inner ear. So the medications which is used to destroy vestibular functions and decrease vertigo, one of which is your intraotologic catheterizations, an attempt to deliver medicine directly to the inner ear using catheter from the external ear canal around the tympanic membrane and to the round window or membrane. The one that provide greatest success is your vestibular nerve sectioning. Okay. Wala kang vertigo, kaya lang kakaproblema ka naman sa iyong vestibula. It eliminates attack of vertigo, can be performed by translabyrinthine approach, okay, in a manner that can conserve the hearing. Okay. Most patients with incapacitating Meniere's disease have little or no effective hearing. So cutting the nerve prevents the brain from receiving input from the semicircular canal. So this procedure may be brief hospital stay and plan of nursing care are presented here in the table that you're going to do in your skills lab. Okay, page 1935. Ito, puputulin yung nerve. So, wala nang function ng iyong vestibula. Wala ka namang, wala ka namang vertigo. Okay? Infection of labyrinth, we call that labyrinthitis. Okay? So, it is caused by either bacteria or virus. Manifestations, sudden onset of incapacitating also vertigo, usually with nausea and vomiting. So how are you going to differentiate whether it is Meniere's or labyrinthitis? Again, ang Meniere's, mayroon siyang triad symptoms, right? Meron siyang sensorineural hearing loss, meron siyang tinnitus or ringing of ears, at meron siyang severe vertigo. Pag labyrinthitis, hindi kasama yung triad symptoms. Management, antibiotic, fluid replacement, antihistamine, and antiemetic for vomiting. Then for the assessment, you use ICE caloric test.
Mastoiditis, this is a problem in the mastoid process. We mentioned already the acute mastoiditis earlier. No? So it is generally secondary to otitis media, disruption of the intercellular construction of the bone and suppurative part of mastoid. May lead to meningitis or brain problem like brain abscess or meningitis. So there is tenderness in the mastoid area, headache, ear pain, anorexia, right? Vertigo. Drainage from the ear if perforated. Fever and swelling over the mastoid bone. Management, antibiotic, surgical intervention, mastoidectomy. For the repair of tympanic membrane, then tympanoplasty. So we mentioned already about culture and sensitivity of antibiotic. Culture and sensitivity of the secretion before giving antibiotic. And for facial paralysis as common complications. So instruct the client to report headache or stiff neck. Sa meningitis, ang tatandaan yung mga anak, yung Brudzinski sign at saka yung Koenig's sign. Utilize safety precautions, position client in unaffected side after the surgery. For the hearing impairment, it occurs in a varying degree and affect many people. Individuals with slight to moderate hearing loss are often referred as hard hearing. Okay, those with severe hearing loss we describe as deafness or deaf. So deaf and hard of hearing people learn various compensatory techniques to offset their problem. Like for example, lip reading or speech reading. Speech reading is the ability to understand speech by looking or observing the lip and tongue movement, even the facial expression and body movements. Sign language also is significant. It allows communication by hand signal. Pero ano yun eh, inaaral din, right? I think meron kayong mga background sa kanyan. Tinuturo during elementary. Okay? Speech therapy is helpful to develop or convert speech for people with speech problem associated with hearing disability. Okay? Can we have a short break? Kasi parang ano na, marami na tayong na-discuss. Okay? Short break muna tayo. Okay lang? We'll continue this after the break. No?